So today we are going to talk about deltoid. Okay, deltoid, which is a shoulder muscle and very important muscle for your upper limb function. And even a patient who is having shoulder pathology or any problem with the shoulder joint, or even it could be axillary nerve. On that time, the deltoid is going to get in trouble. So the first we need to know about the normal anatomy, that how this deltoid is there, how it is present in your body, और वो कैसे काम करता है, किस तरह से, what are the actions of that muscle that we'll see. So deltoid, it has the three part or three head. It has anterior fibers, middle fibers, and posterior fibers. So the anterior fibers, it arises from, we can see over here, ये जो है, the first one is the anterior fiber, which is arising from or originating from anterior border and adjoining surface of the lateral one third of the clavicle. So here you have clavicle bone, and that lateral one third of the clavicle is giving origin to the anterior fiber. Lateral one third of the clavicle से आपका deltoid का anterior fiber origin होता है. Then we have acromial fiber. Acromial fiber is getting originated from the acromial process, the lateral border of the acromial process. तो आपका जो लेटरल बॉर्डर जो होता है एक्रोमिन प्रोसेस का, वहां से लेटरल फाइबर्स या तो एक्रोमिन फाइबर्स ओरिजिन होता है. अभी यहाँ पे एक वेरी इंपॉर्टेंट थिंग इज वी नीड टू अंडरस्टैंड. So deltoid is a multipinate muscle. In that, what do you mean by multipinate muscle? The middle fibers of the deltoid or acromial fibers of the deltoid, in them, multiple amount of muscle fibers are located or situated in narrow area. In this much area, you have multiple fibers are like present. So the four septa of origin of this deltoid, the acromial fibers, are originated from the acromial process. And then the posterior fiber is arising from, we can see over here in the third diagram, the posterior fiber, it is arising from the lower lip of the crest of the spine of the scapula. So in that way, we have anterior fiber, middle fiber or acromial fiber, and posterior fiber. These three head or three fibers are present in your, three types of fibers are present in your deltoid muscle. So this is about the origin. So the anterior fiber from the lateral one third of the clavicle, मिडिल फाइबर या तो उसको एक्रोमियल फाइबर भी कहा जाता है जो मल्टीपिनेट है, वो आपके एक्रोमियल प्रोसेस के लेटरल बॉर्डर से ओरिजिन होगा. एंड द पोस्टीरियर फाइबर इज ओरिजिनेटेड फ्रॉम द लोअर लिप ऑफ द क्रिस्ट ऑफ द स्पाइन ऑफ द स्कैपुला. Now where it is inserted, कहाँ पे वो खत्म होता है? So it is inserted into the deltoid tuberosity of the humerus. Now the another three septa, okay, the four septa is getting originated from acromial process, the acromial fiber. Now the three septa is inserted into this deltoid tuberosity, and that's why this is very important part. And that's why it is called as multipinate muscle. We'll see in detail about it. So it is inserted into the deltoid tuberosity of the humerus. Deltoid tuberosity जो होता है humerus का, वहाँ पे वो insert होता है. Now supply, it is supplied by axillary nerve. The root value is C5 C6. तो अगर कहीं पे भी axillary nerve में डैमेज होगा तो ये deltoid का फंक्शन आपका खराब हो सकता है. कैसे, वो हम आगे देखेंगे. The acromial part, which is a multipinate muscle, out of these three fiber, acromial, anterior and posterior fiber, the middle fiber, या तो उसको acromial fiber भी कहा जाता है, जो एक multipinate structure होता है. Multipinate होने की वजह से वहाँ पे बहुत सारे fibers narrow area में आके locate हो जाते हैं. That's why it is a very strong abductor of your shoulder joint, because as we'll see now, the acromial fiber, it's a powerful abductor of the shoulder joint, which is doing the shoulder abduction from 0 to 90 degree. So from 0 degree, like when my arm is at the side of my body, and from there, अगर मैं उसको 90 degree तक लेके आ रहा हूँ, तो ये 0 to 90 degree का abduction is done by acromial fibers of the deltoid. It is multipinate structure, which make it more stronger because the small area is containing large amount of muscle fiber. और इसी वजह से सेम साइज का दूसरा मसल होगा जहां पे वो मल्टीपिनेट नहीं है, दूसरा मसल जो मल्टीपिनेट नहीं है, तो उसके कंपैरिजन में डेल्टॉइड इज मोर स्ट्रॉन्गर मसल. Anterior fiber function is it does shoulder flexion and your internal rotation. So shoulder flexion and internal rotation is done by anterior fiber. The posterior fiber will be doing shoulder extension and external rotation. So in that way, this function is done. So clinical anatomy, if you see any kind of damage to the deltoid, how it can happen. So the पहले तो clinically हमें याद रखना चाहिए कि deltoid is one of the site where we give intramuscular injection. Many a time we had taken injection in deltoid area, mainly in this middle fiber. कई बार ऐसे होता है कि the person who is giving injection, if they are not experienced one, it can cause damage to the axillary nerve और वहाँ पे deltoid paralysis हो सकता है. इसीलिए it is very important to give injection in the middle deltoid rather than anterior posterior में देने के बदले middle deltoid में देना ज़्यादा ज़रूरी होता है. So the intramuscular injection is given in the middle deltoid, middle of the deltoid, and that's why we can prevent the axillary nerve damage. The another thing is, if you want to know whether your deltoid is, if you want to know that in your patient whether it is working or not, okay, the deltoid is working properly or not, what you can do, you can ask the patient to do abduction. At the same time, you give downward resistance. So patient is going to lift his arm और आपको नीचे की तरफ धक्का देना है. So if the patient is able to push you, or if the patient is able to perform this movement against your resistance, that means the deltoid is working. So it is, we can see in the figure that a guy is doing shoulder abduction and जो therapist है वो उसका deltoid को resist कर रहा है, उसके movement को resist कर रहा है. In that way we can do, we can check it out whether deltoid is working or not. Another thing is in case of dislocation of the shoulder joint, okay, or else dislocation of the shoulder or surgical neck of the humerus fracture. It's a spelling mistake. So dislocation of the shoulder joint or surgical neck of the humerus fracture. In that case, the axillary nerve can get damaged because the axillary nerve is passing nearby to that structure, head of the humerus के आसपास होता है. अगर आपको कोई ऐसा पेशेंट हो जहाँ पे एक्सिलरी नर्व डैमेज हुए, वहाँ पे सबसे ज्यादा प्रॉब्लम डेल्टॉइड में दिखाई देता है. हालांकि एक्सिलरी नर्व इज आल्सो सप्लाइंग योर टीरीज माइनर, बट हियर द डेल्टॉइड इज गोइंग टू गेट अफेक्टेड more, where you will find loss of rounded contour of the shoulder. The rounded contour, the round shape of the shoulder, what you see, it's because of deltoid. So when the deltoid is paralyzed, it will get flattened. Your shoulder will get flattened. वो एक साइन है. दूसरा होगा कि prominent of the greater tubercle of the humerus will get prominent, and generally you cannot see that because the deltoid is there, muscular halo. But in case of that paralysis, greater tubercle of the humerus will get prominent. Then paralysis of the deltoid will cause loss of shoulder abduction up to the 90 degree. The patient will not be able to do the shoulder abduction. अगर आप उनको फिर भी बोलोगे तो क्या करेगा, ऐसे करके he will try to do the shoulder abduction. So that's called a strict movement. वो एक abnormal way में movement करने का try कर रहा है, कोशिश कर रहा है. But it is because the deltoid is not working, and he will be using other muscles, especially trapezius or supraspinatus. So because of that, the patient will not be having a pure movement of abduction. Instead of that, he will do elevation and he will try to do the abduction. So that kind of trick movement can happen. The another problem which can happen will be the sensory loss over the lower half of the deltoid. So in the lower half of the deltoid, this area will be having loss of sensation. It's like a band. The band-like area is going to get affected, and that's why it is called as regiment badge. That area, but in the, if you see in the army, they apply the badge over here. So this regiment badge, it's also called as regiment badge. This, you can see the rucksack palsy. Rucksack is like in army people when they carry the weight on their shoulder in a bag, which is like somewhere around 15 to 20 kilos of weight they will be carrying. In that case, there are chances of developing axillary nerve damage. Even the musculocutaneous can get involved, and nerve to serratus anterior also can get involved. So in this situation, also patient will be having not only deltoid is also paralyzed, but at the same time biceps and anterior, so serratus anterior also will get paralyzed. तो यहाँ पे आपको पेशेंट में दिखेगा कि they have deltoid paralysis, that is called as rucksack palsy. So all these things are there regarding deltoid which you need to understand. So deltoid is a very important muscle. I kindly go through that, and if you have any doubt, do let me know. Thank you.